Hello, everyone, and thank you for joining us today for the ICTR Enrichment Series presentation. I want to welcome our guest speakers, Amy Yarnell and Fraticelli. Both are our data services librarians from the Health Sciences and Human Services Library here on campus. And they will be presenting today information about the new NIH data management and sharing policy and what resources are available to our faculty and researchers here on campus on how to comply with those requirements. They will also talk about a free online application, the DMP tool, and strategies for choosing a data repository and insights into data sharing best practices. Before we get started, I just want to remind everyone that this event is recorded, and recordings of all enrichment series events are posted on our ICTR website. At the end of our presentation, we will reserve about 15 minutes to take questions. And if you would be so kind, please add your questions and comments using the QA feature of Zoom. And also, we do have a satisfaction survey that we hope that you will take a few moments to complete at the end of the presentation. We will also be sending you an email with the presenters' slides and also links back to our survey, and the library also has a survey that they would like you to complete as well. And with that, I'm going to turn this over to Amy and Irma and let them share with you the wonderful resources that our library has.
Great. Thank you so much, Wanda. Let me get my slides up here. Okay, and I'll just turn my video off if you don't mind, so you can see the slides a little better. All right, great. So yes, as Wanda mentioned, we are talking about the NIH data management and sharing policy. And in particular, we'll focus on an overview to make sure everyone's on the same page. We'll look at kind of the two sort of biggest questions we get, which are what goes into my plan and how do I choose a repository for my data? And we will be looking specifically at using DMP tool to write your plan. And we'll wrap up with just a couple data management best practices to keep in mind during the process. So this policy, there are two requirements. The first is that you submit a data management and sharing plan with any NIH grant applications for projects that generate scientific data. You'll be expected to describe how you intend to manage and maximize sharing of the scientific data you generate. And as the second piece, you need to comply with the plan that you write. So it's important to write a plan that you can follow. And again, this policy has been in place just since January. So there's still a lot of things that we're learning and new information that's coming out. Okay, there we go. So the evaluations of the data management plans they are done by program staff, so they won't be part of the peer review process. The plan has to be approved prior to the award, but shouldn't have an impact on the overall score. You may be asked to provide additional details or revisions to your plan, and this would happen as part of the just-in-time process. In terms of compliance, again, this is one of those two requirements of the policy. And so the plan will become a term and condition of your award. This will now become part of your annual progress reports that you report on how you're complying with your plan. If you're doing human subjects research, you'll also want to be sure that any information you supply to the IRB and in informed consent documents will be the same as in your data management and sharing plan. So in other words, don't tell the IRB that you're not going to share data and then tell the NIH in your plan that you will share data. Again, since this policy has only been in effect since January, and we haven't gotten to those first annual reports yet, it's likely that we'll still learn a lot more details about how compliance will play out. So stay tuned for more information as we get it. The NIH does recognize that there could be costs associated with data management and sharing. There are certain allowable costs that can be included as part of your budget justification. These would be things like the cost of data deposit, de-identification, developing documentation, but not for things that would be included in institutional overhead or as part of sort of normal research costs like data collection. Again, what you put in your data management plan and in your budget and budget justification should be aligned. So if you say you're going to use a repository that has a deposit fee, you should probably mention that deposit fee in your budget. And as far as I understand, when you're creating these budgets, you do need to have a line item for data management and sharing costs. But if you don't have any costs associated with your plan, you can put 0 for it, but it still needs to be in there in some way. You do want to be thinking about potential costs early on. It could take time if you need to work with a repository and get a quote and that kind of thing. So leave yourself time to investigate what these costs could be. So before I get kind of into what the elements that you want to include in your data management plan are, I do want to say a little bit about this concept of fair data, which you've maybe heard used before. And this is the idea that shared data should be findable, accessible, interoperable, and reusable. And I want to bring this up because it comes up in discussions of data management and sharing. It's something that I'll be referring to as we cover the elements of your data management plan. And so the qualities that make your data fair would be things like having a reliable, persistent link, being well described and indexed in an established repository, having clear instructions for access, being able to be combined with similar data sets, and having clear terms for reuse in other studies. So I'll try to point out how some of the different elements of your plan will tie into these FAIR principles. Okay, so a data management plan is a pretty short document. You may have heard that the 2 pages is about what your plan should be. More complex research projects will be a little longer than that. And you can think of your DMP as a living document. Okay, so it's expected that your plan will evolve as your research does. So when you're thinking through this, don't worry too much about locking yourself into specific decisions. You will have an opportunity to submit revisions to your plan. The first thing that your data management and sharing plan should talk about is your data types of your project. And this kind of includes 3 subsections. So basically all the types and amount of data that's being generated, the subset of that data that's being preserved and why. So you don't need to share absolutely everything. And then what sort of metadata and documentation will be available to help understand the data. So your goal here is to be thinking about the basic scope and scale of your data and be thinking about the documentation a person would need to make your data usable by another researcher. And think broadly about what data means. Lots of things are data, measurements, sequence reads, surveys, interviews, images. A lot of different types of data can be generated by a project. Next, you want to talk about any related tools, software, and code. And these are software tools or code that's needed to work with or access your data. So if you have data that's in a SAS or Stata format, you're letting people know that they might need that software to open your files. Or if designing some custom software is a part of your project, you might talk about that and if people can get access to it. And it is good if you can use open file formats or open source software or open code. If you publish any code you needed for your analysis, those are all things that's really helpful for sort of the reproducibility and replicability aspect of your project. Next section asks about standards. So in this, you want to think about if you're using metadata standards, controlled vocabularies, or file standards. So things like if you're using ICD-10 codes, or if you're following, if you're using a particular validated instrument to collect information, you can talk about that in section 3. So next is preservation, access, and timelines. And so this is the element where you'll be asked about your repository. So where you're planning to share data. Okay, so I just want to emphasize they really want people to think about a repository to share your data rather than trying to store it kind of internally. And again, this is because of the FAIR principles so that your data will be more findable, accessible. Let's see, what else is I going to add here? So if, in terms of the timeline, so in most cases, you'll be expected to share your data by the time of your first associated publication, or the end of the performance period of the award, whichever comes first. And so we will talk a lot more about kind of how to answer this question in sort of the second half of this talk when we talk about choosing a repository. If there are reasons that you can't share your data or can't share it fully or openly, you'll talk about the limits to it in section 5. So the limits to data sharing in section 5. You'll also talk about how you plan to keep your data safe and secure, especially if you're working with human subjects data. And then last section is oversight of data management and sharing. And what you want to think about here, again, is who's responsible for that compliance aspect. And generally speaking, this is going to be the PI. So the main thing that you'll be answering is who the PI is. But if there's anyone else on the project who is involved with data management and curation, you could mention them as well. Okay, so those are sort of what goes into a plan. And now I just want to highlight this tool that we have, DMP tool. It's free, open, web-based form. It will lead you through kind of the process of writing your plan by breaking it down element by element. And it also provides some sample answers, some links to useful guidance from NIH and others. And another really great thing is that you can request feedback on your plan from us at the Center for Data and Bioinformation Services. So I do want to take a few minutes to just take you on a little tour of DMP tool. So pardon me while I just switch my screen sharing here. Let's see. Share. Try to stop sharing first. There we go. Okay. Okay. Are you seeing DMP browser window with DMP tool now?
Yes.
Okay, great. Thank you. Okay, so you can find DMP tool at dmptool.org. One thing that's really nice is that UMB is a member institution. So you don't need to create a new account. Just use your University of Maryland email address, and it will sort of confirm that you are from University of Maryland, Baltimore, and then it'll sort of take you to the usual login page for UMB, where you just need to enter your UMB username and passphrase. So when you get onto DMP tool, you'll see a screen that looks something like this, although your dashboard might be kind of empty. And then you have some options along the top, creating a plan. There are also links to requirements from different funders and some publicly published DMPs. So what you'll first want to do is go to where it says create a plan. This will ask you some information to get you started. So for what research project are you planning? You might just put the name of your plan. So something like my grant title, data management plan. If you just want to kind of play around in here first before submitting something or before writing your plan for real, you can say that it's a mock project for testing. If you signed in through UMB, then your University of Maryland, Baltimore should be already filled in as the research organization. And then at the last, you want to select your funder, and this is how you get the right template to use for your plan. So if you select National Institutes of Health, there are a few different templates available. These second two are pilot templates that are right now being tested as part of a federal demonstration partnership. So I would recommend that for now you just stick with the default and create your plan. Okay, and then you have some tabs here in this section: project details, collaborators, write plan, research outputs, request feedback, finalize, and download. So project details is sort of a little cover page. This is useful mainly if you want to share your plan with someone, or if you're working on a lot of different projects and you want to make sure that you're accessing the right one, having your title and abstract and some other information here. You can include your grant number and the funding opportunity number as well. In the collaborators tab, there's two sections: contributors and collaborators. So contributors are just sort of other co-authors. You're just giving them the correct attribution that they were involved with this project. But in collaborators, you're actually adding people to your DMP tool template so they can interact with your plan. And there's different levels of permission if you want to give someone read-only access or allow people to make comments and edits. You can choose that there. And they don't need to be UMB members. DMP tool is free for everyone, but as part of the UMB community, we have access to that single sign-on and a couple other features. So the third section here, this third pane write plan, is really where you'll probably focus most of your time. These 6 elements should look kind of familiar. Those are what I just talked about a couple slides ago. And so you can expand each of these sections. Each section starts with a little description of what should be in that element. It gives you this text box to do some writing. And then underneath the text box, it gives you some examples of answers. And I do want to stress that these are example answers. Don't copy and paste them into your own plan. When that happens, I find that things will often wind up in there that maybe don't apply to their own plan. Okay, so remember that you need to be able to follow the plan that you write. So I definitely recommend using this as like a guide, but still kind of writing your answers in your own words. And as you fill in answers, this section will fill in. So it says they're 0 out of 3, and it'll just help you keep track. Make sure to save often because there's no autosave feature, so there is a save button. Over on the side, there's a guidance and a comment section. So guidance is just some additional details about what's expected in the section, some additional information. But if you switch over to comments, you'll see that you can leave comments, or other collaborators can leave comments on parts of the plan. The next tab is research outputs. And this is an optional section, but it's really useful for keeping yourself organized and helping you to prepare for your progress reports. If you click on add a research output, you'll see there are several options of types of outputs, including a data set is something you can add. And then you can also add a repository where you might want to share metadata standards, access levels, initial license, file size. So again, this is just, it's not something that you would need to submit to the NIH as of right now, but it is something that can just really help keep yourself organized. I definitely want to highlight this next section, request feedback. If you select this button, then Irma and I will get a email saying that you want us to review your plan. Just be mindful of our time frame. We usually say about 2 to 5 business days, kind of depending, the closer it gets to submission deadline, probably the more of these we'll have to review. So just be thinking about getting our feedback as early as you can. And finalize, again, this is sort of a value added section of DMP tool. One of the things is that once you kind of satisfy these 4 criteria down here under register your plan, you can get a DOI that's specifically for your plan. So again, you can link your plan with the items you produce, the research products you produce to fulfill your plan. So that's kind of a nice handy tool here. And then finally, you can download your plan and attach it to your grant application. And this should be in a format that you can pretty much just add directly. You may need to do a little bit of editing or formatting, but you can export it as a PDF. You can export it as a Word file. And with the PDF, you can adjust the font and the font size. And that is DMP tool in a nutshell. So again, I definitely encourage people to make use of this tool for help with your projects, for writing your plans, and for getting feedback from us. Okay, so I'm going to go back to slides now.
Amy, I just want to interrupt real quick regarding this tool and the plan that it generates. There was a question from someone on campus if there's been any feedback from the NIH regarding grant submissions that have included, the DMP plan in their submission. Have you heard of anyone who has used the tool, submitted it with the printout with their grant submission, and if there was any feedback from the NIH on it?
The last I heard, sort of the just-in-time process and like those reviews hadn't happened yet. I don't know if they've happened now. I am hoping to get some feedback when it does. And if you know anyone who submitted plans, and feel free to tell them to share with the library. So I don't know, but I do know that I think NIH is kind of working with the DMP tool to some degree. And I'm also part of a group of librarians that's been working to update the template and to sort of make sure it goes along with their format that they want. So it's, in terms of the format, it's designed to go along with it. In terms of the content of plans, I haven't heard yet any feedback.
Okay, thank you.
Okay, I just want to make sure, sure, you can see my slides again? Or are you still looking at DMP tool?
Yes, we can see your slides.
Okay, great. Okay, so again, our slides, which are available to you, have a few more links for more information about this. Okay, so I want to shift gears a little bit now and talk about that other big component, choosing a data repository. So we want to understand that there are a few different models out there for repositories. And here we've kind of outlined some of the main dimensions along which repositories can differ. Most repositories will have some mix of these qualities. So regarding subject, there are repositories that focus on collecting data for specific programs, data types, or subjects. So these are your domain-specific repositories. And you can contrast this with generalist repositories, which allow most data types from most subjects. And then there's also institutional repositories, which only collect data by researchers of a given institution. So here at UMB, we have the digital archive, which is more for publications and posters and that kind of thing. But we don't really accept data into that repository yet. But it's possible in the future that we could have something like that. Another way that repositories differ is in their level of access. So if they provide open access or controlled access, and we'll talk a little more about some of those mechanisms in a moment. There's also a difference with the curation of a repository. So some are, we'll let you just kind of upload your data, leave it to you to supply your own metadata and documentation. What you upload is what gets put out to the public. But there are other datas that offer curation services, and so they'll kind of check your submission and make sure that it's complete, and they might supply some additional documentation and metadata. There's also some repositories out there that are free, and others that might charge a fee for curation or deposit. So I want to focus a little more on the kind of subject differences and the access differences. So this slide lists really just a few examples of the many domain-specific repositories out there. And that's kind of one of the first things you want to think about is, is there something that's a natural fit for my data? Either it's something that's associated with my institute or my subject area or my program. There are some that might accept only certain data types. So things like the NCBI databases that really focus on sequence data. Others might be more broad in scope and kind of collect on general subject areas. So ICPSR is focuses on social, political, behavioral data. So it's domain specific, but it also has a pretty broad scope of what it can collect. There are others that might focus on, say, a particular condition. So the Cancer Imaging Archive, which also focuses on imaging data, the AD Knowledge Portal, which collects a lot of different information on Alzheimer's disease. If there doesn't seem to be a domain-specific repository for you, then you might want to look at a generalist repository. And these will, again, usually accept most data types and subjects. The repositories on this slide are part of NIH's Generalist Repository Ecosystem Initiative, which is aiming to develop some common standards around generalist repositories. And even within this list, there are some ways that these repositories differ in terms of the size of data they accept, the degree of access and curation, and associated costs. So one, for instance, that's a little different is Vively, which actually focuses on clinical trial data and does have a controlled access model. So this is kind of the other big key decision that you'll have to make between domain-specific and generalist is the access level for your data. If you want to choose an open or a controlled access repository, and there's kind of a continuum here of different models. So data that's in kind of an open model might be things that are de-identified, that doesn't include any direct identifiers of people in the data. It can include aggregate data. This is the sort of data you might see if you go to, say, data.gov, Open ICPSR, Census Bureau, and also Dryad and Figshare, the generalist repositories we mentioned on the previous page. And even some of these repositories that will let anyone access it might require you to create an account. So anyone can create an account, but you still have to go through that step of getting access to the data. And by doing so, you could also be agreeing to certain terms of use. A controlled access repository will usually require some kind of formal data use agreement and might also require a secure download process. And an even more restrictive model might require users to access data within a digital enclave or a virtual desktop environment. And as yet more restrictive, there are some data sets that you can only access physically in person on site in a physical enclave. There could also be a model where sort of like what you might see for AHR data, where you would request variables and you're kind of given that curated access to data, but not to the full data set. Okay, and some things to think about to know if your data requires controlled access. If there are limitations on subsequent use, so whether because of a law or because of certain agreements that you have in place, if the data is sensitive and includes either identifiers or even more so if it has information about stigmatizing traits or data on people that are very easy to identify because of some unique attributes. And if your data, for whatever reason, can't be de-identified, these could be, it's something like qualitative data can be very difficult to fully de-identify. And so you might need to think about how to mitigate risk of re-identification through a controlled access model. It's also possible that there are things we can't quite predict yet. And so if you sort of discover that there's some technology or something that poses a risk to participant privacy, you might think about adjusting your original plan. Okay, so these revisions are acceptable when necessary. Okay, so those are just some things to think about and some different kind of models of access for your repositories. We've linked here on our slide to a number of tools that can help you find some of these different repositories and look for information about them. So the NIH links to, let's see if I can show this. They have this little searchable database with, you can search by certain keywords. You can filter by the ICO. So that's should maybe be your first stop if you're doing NIH research. Nature also has a list of recommended repositories by subject area. And then this registry of data repositories is a really big list of repositories of all different subjects. One caveat here is that they aren't necessarily all open. Some of them accepted data from certain projects, but now it's closed. So this is a pretty comprehensive list, but I would maybe start with one of the first two to find a more focused list. Another option I want to mention is the UMB data catalog. So this isn't a repository. It's as it suggests, it's a catalog that stores records about data set. It's managed by the HSHSL, so right here on campus by the library. And what's useful about it is that it allows you to have a really rich record of your data, a really rich description with good metadata. So if you it's impossible to completely share your data, maybe you don't have, the rights to it or something like that, then you can at least share this really good record of your data with a really full description. So it's good if you can't share your data. If you can share your data, it also just provides another way for people to find it by being indexed in this catalog. It helps, it focuses on data by UMB researchers. So it's a good way of really focusing on all of the wonderful research we do here. And it can help promote collaboration. You could, maybe find other people on campus doing similar sorts of research to you. And each record has a detailed description of how to access the data. So it helps to support the process of data reuse as well. And so this slide links out to the catalog, and it just shows you what a typical record would look like. Links to the author and other data sets from the author, description. And you see all this metadata like the time and geographic coverage. We have used a lot of mesh terms, so some standardized metadata there. Also links to your publications, so another way of making your publications more findable. And everything always has this button to access the data. And sometimes this can go to something like instructions for requesting data if it is through controlled access. Okay, so data catalog, I definitely recommend getting, and actually let me show you here. I can link to that. Oops. So to include your data set, if you go to the datacatalog.hshsl.umaryland.edu, there is a little form which you can just fill out with some kind of basic information, and we'll reach out to you to develop your record. Okay. So again, when choosing a repository, these are just some questions to ask yourself to help you find the right fit. So do you have the rights or permission to share the data? Is there a sort of obvious place for it to go? Then that kind of makes your decision for you. You want it to meet these desirable characteristics of repositories that I've linked to here. And these are things like offering persistent identifiers and having a good sustainable plan for managing the data in the long term and other things like that. If the data that you want to share is sensitive, then you want to be thinking about controlled access models. If you don't have funding to spend on curation and data deposit, then you might want to be looking for free options. Although remember that you can request funding in your budgets. And if your data is maybe kind of complex, if you need some help with the data deposit and getting your data into a more usable form, you might want to look for repositories that offer some curation services. Okay, so just to kind of wrap up everything here, I just want to encourage you all to follow some good data management practices. So these are things like making sure that you have clear and consistent names for your files, for your variables, and making sure that you're documenting all of these choices by using things like data dictionaries, README files, and code books. So if you're getting ready to share your data, it will be very helpful if it's organized and if and for most deposits, you'll be expected to provide some of this documentation. So you want to have that kind of ready to go and not try to kind of work backwards to create these. You want to try to use established metadata schemas and standards if they're available to you. Not all projects and fields will have them, but most will. And this can really help make sure that your data will be interoperable with other data sets. You also want to be thinking about storing your data and creating backups. So this is kind of thinking about the active storage in addition to that long-term repository storage where you're sharing your data. You can't share your data if you lose it, of course, if you have a data disaster. So if you use something like the university's OneDrive, some of that process of creating backups might be happening already. But otherwise, make sure that you're storing your data somewhere safe and secure, a locked file or locked computer or that kind of thing. Also, wherever possible, make use of persistent identifiers. So these are things like your ORCID IDs, your DOIs. This will help uniquely identify you and all of your research products and connect them to each other. And so this will be helpful when you're reporting on your progress, and also help you get credit for your work. And again, if you're working with human subjects data, make sure that you're thinking about data sharing when you are getting your informed consent documents together. You'll want to be asking for permission to share data at the outset of your project rather than trying to go back and contact people. Okay, and so that is, I think, everything that I have for you for now. I am happy to take questions. And again, you can find these slides and related material online. Yeah. Happy to take questions.
If anyone has a question, if you could please add it to the chat feature, that would be great, or the Q&A feature. We'll accept either one at this time.
While people are thinking, I will just point out all of the many resources we have available to you at CDABS. Lots of different data related things that we can help with. And here's our website. And you can also email us at data@hshsl.umaryland.edu. So whether it's help with writing your plan or visualizing or wrangling data, we do all that
So
stuff.
So Amy, we do have a question in the Q&A feature, and this is from Dr. Schaefer. She says, in the past, I have gotten formal data sharing agreements by way of the university and the receiving entity. Not needed in this context, I assume, because part of the grant application?
Yeah, so I want to make sure I understand this question. You don't, you won't necessarily, I don't think, need to provide a data use agreement in your application, but it's possible that you'll be talking about data that will need a data use agreement to be shared. I'm not sure if that's answering your question, but you could still, if you describe data that is being shared by control access. So I guess maybe what you're thinking about it, like, so if you're kind of holding on to the data, I think is maybe that what you're thinking of. Like, so if you are holding on to the data and you get a data sharing agreement, that's an arrangement that could still happen. It would be, it's better, it's preferable, I should say, to put your data in a repository, but there might still be a process of a data use agreement depending on the repository. Some require that.
Maybe it would be best if I have asked Vana if she could allow Dr. Schaefer to speak. Maybe that would help clarify her question. Vana, would you be so kind to allow Dr. Schaefer to speak? And it looks like you're muted right now, Dr. Schaefer. Do you want to try and unmute?
Hi, yes, can you hear me?
Mm-hmm.
Yes.
Oh, great, thank you, sorry. Yeah, I have had, I've received data and I've shared data out for like collaborations and things in the past. And this was before the NIH data sharing requirement and generally for projects funded by other funders. And I've had to work with my grants office to get formal contractual arrangements for those situations, that specifies, who gets the data and how it will be used at the place I'm sending it to. And again, this was more like between two universities, or in one case, it was between a public system that I was partnered with, like a Child Protective Service system, and we were sharing data back and forth. And I'm just, so in my mind, I thought I always had to do that if I was sharing any data, that was sort of owned by my university and went through my IRB, and and I'm just making sure that we're in this context of NIH funded projects, that it's all sort of baked in the cake, right? In terms of the university in the proposal process sees that this is a requirement of the award, and thus the contractual pieces are there.
Mhm.
I mean, I think it's an obvious thing, but because I've had a longstanding habit of working with my grants people to, and we've iterated on language about,
Right.
I mean, so I'm just sort of making sure that if it's NIH, I'm good and I can just proceed in all the ways that you've described.
Right. So I think the main reason that you had to do that again is because you were holding on and managing the data, and again the sort of mechanisms of putting it in a repository were a little less understood. So if you put it in a public repository, you can do that, right? You can put it in either if the data can be shared openly, if it's not sensitive, you can put it in something like Figshare, Dryad. But it is still possible that you could have to go through some process like that. It could be that there's a data sharing agreement that the repository provides and that you would have to get signed and that kind of thing. But I don't think,
Okay.
my understanding at least, and someone from the university might want to confirm that, who works more in that area, is that you don't have to ask the university permission to share the data. Most of these repositories will kind of clarify that they aren't the owners of the data, that you still kind of retain those ownership rights, even though they will be holding on to it in perpetuity.
Right. And I'm realizing, just for additional context, in case anybody's getting worried about this now, some of the data sharing I was describing was not to public repositories, right? So it was just maybe like with a collaborator at another university, right? So it's just, I have it and now that collaborator has it. So there's no public element. That would be one difference, I think, as you explain it more. And then the other time this happened to me was prior to the NIH arrangement. I had an NIH funded award, and at the point of publication, the journal and my program officer both had a data sharing requirement. So my program officer at NIMH held me to something like the standard that you're describing ahead of the requirement for it. So that then, I had to go and get permission because there was, I can't remember exactly if it came from it wouldn't have come from the manuscript, from the publication entity. I don't think it was, maybe the repository or maybe because my program officer, I can't remember exactly why I had to do it, but I think, so that's just, I think I understand better. We're probably in good shape unless you hit that wall later, I think is how I'm going to think about that. If there was an extra wrinkle, but generally you're approved if NIH funded to do the public repositories. That's really helpful. Thank you for the deep dive on that. I appreciate it.
Sure. Any other questions?
We still have a few more moments here if someone has additional questions.
And again, while people are thinking, I'll also point out that in addition to what we do at the Center for Data and Bioinformation Services, there's a lot that the library does in general. Every school has their own librarian, and they do things like expert literature searches for faculty and staff. They collaborate on systematic reviews. They consult on publication strategies and kind of thinking about your research impact. There's also a fund for author publishing charges. This is mostly geared for its kind of like junior faculty or student publishers. And they do a range of customized instruction as we do as well. Yeah.
Amy, if you don't mind, I would like to share the home screen for the library.
Yep.
Let me grab that.
Or sorry, do you want me to put it up?
Well, I did have it up. There it is. And now let me just, there it is. I don't know how many of our attendees for the seminar have actually visited the HSL library website, but a lot of resources at the library. And this is the link for the services that Amy and Irma have been presenting. If you want to connect with them, this would be your best point of entry. But in general, if you do have something that you want to look for, this search HSL website is your best link for looking at services that are available through the library, but also take some time and just peruse the tabs on this panel here. And you'll see that there is an abundance of resources. If you use this one search field, it takes you to a lot of external websites and resources. But if you're really looking for something that's within the HSL library, for example, if you're looking to do, oops, I spelled that wrong. An ORCID ID, this would be, a good place to start. And if you don't have an ORCID ID, we really strongly encourage you to do so. It's really a good way of tracking your publications. And it assigns an ID unique to you. And actually, a lot of your grant applications do require, your NIH grant applications require an ORCID ID now.
And it takes very little time to do.
So there's some questions here in the chat. I'm just going through this, but it looks like someone has, Malika Yao is asking, when's the best time to update data management and sharing plan?
So I think whenever there might be changes to your project, you would want to update it as soon as possible. In terms of writing your plan, I would be thinking about it early on if you're working on an application. I would definitely try not to make it an afterthought, because you'll see it's kind of integrated with a lot of the pieces of your project. I'm not sure if that answers your question. And it's true that it's a good idea, even if you're not applying for a grant, any project you have, especially if you're working with a lot of collaborators, it's a really good idea to have a data management and sharing plan. And I think most funders are kind of requiring something like this now, also besides NIH. Great.
Well, if we don't have any further questions, I think that we can let folks go and have their lunch if they haven't already done so. And really, really want to thank you, Amy and Irma, for attending and providing this information. It's something that we have been talking about. We know it's important, and we wanted to make sure that we could assemble some resources and be able to get this information out to the campus. And with that, we will be sending out an email to the attendees and probably across the campus as well to people who weren't able to make or attend this session, so that we can provide them a link to this presentation as well as to your slides. And this other contact information that you've added into the chat would be, we think, very helpful, and really appreciate it. Thank you. It's always nice to put a face to a name as well.
Great, definitely. Yeah, thank you so much for having us here. It was great talking to all of you, and data@hshsl.umaryland.edu if you want to reach out to us. Have a good afternoon.
Bye, everyone.